Hey there, everybody. Today we're going to talk about something that's on every manager's mind come reporting time, and that's the CBRT report, which stands for the Community Based Reporting Template. The purpose of these community based reporting templates is so that we can provide information to our federal government in order to justify the funds that we receive on an annual basis. This is one of the reporting items that across the board we need to be able to fulfill from all of our First Nations clinics. So GHL's developed these forms that allow us to be able to track this information over time. And with that, we're able to extract the data and organize it efficiently in our Excel spreadsheets. So the first thing is we need to find these forms. So we'll go to records. And now we need to open up a patient. I'm going to go 102, which should bring up Grandpa at PSS. And the reason we call these service forms is the idea is to input it into the patient's chart following each service that has been provided to them from a working practitioner. If this is done correctly, then the information will be logged in the patient's chart and we'll be able to reference it to catalog each interaction between provider and patient throughout the entire year. Now, most of our stakeholder communities will have a toolbar set up very similar to this one. This one's for nurses. However, they should have a service form button laid out. Now, in this case, there's a home care service form and a nursing service form. But if you don't have a toolbar set up for yourself, no worries. It should be right here in your custom form library. And all I need to do is type in GHL. And these forms right here that are labeled GHL from communicable disease control and management, community birth report, there's a healthy babies early infancy, maternal, home and community care, mental wellness, and a nursing service form. Now I'm going to show you, for example, what the mental wellness service form will look like. This is an example of what the mental wellness service form looks like in the chart. Now, if I don't want it to go directly into the chart right away, I have the ability to press F2 on my computer. Again, type in GHL, select mental wellness. And what the F2 function does is it essentially just provides the custom form in a separate window before going into the chart so that you can complete it on this window before going and adding it to the notes, or you can discard it if you think you've made an error. So essentially what this form is capturing, it is capturing our service's location, the type of interaction it was, whether it was with individuals, families, couples, phone. It captures the mode, whether it was walk-in, on-call, a scheduled appointment. These are things and metrics that we're trying to capture long-term in our clinics, not only just for the CBRT reporting, but this is something that a clinic may want to know just for its own information. And in this particular service form for mental wellness, we capture the amount of time spent between the provider and the patient. We're capturing the primary issue for the why they're coming in to seek services, and then the secondary issue. Maybe there's more than one issue that's going on with this patient. We also want to capture the provider and the gender of our patient as well. So on this mental wellness service form that you see, we've got it broken down into quite a bit of check boxes that we'll click off. Now take note that every single one of these check boxes is a direct line from the CBRT template. So all of these questions, or all of these points rather, come directly from the CBRT because this is what we need to report upon. So based on the interaction and the service that's being provided, it's going to fit one of these boxes. And notice when I click the intervention after a death, suicide with those affected, another box comes up. So keep in mind that some of these service forms have tucked away little surprises or pieces to the form that might not be there right away. They might have to be triggered by another event. And in this one in particular, we've got the service linkages. And this is essentially just saying what external resources were contacted for this interaction. Keep in mind we can add to any of these fields. Now, if this happens to be an interaction where the client was discharged during this interaction, then we would select client discharge from mental wellness program, give our details, and at the bottom, we have our space and area that we can include our clinical notes so that we can reference that for the future. Now, keep in mind that these service forms have been created to capture the information for all roles and providers that fall under the CBRT reporting template. Now, this one's for home and community care. Very similar to the mental wellness service form, we have our options that we would click off, and then things will appear based on what we've selected. Now, it might seem a little overwhelming at first to capture this information on a day-to-day basis, but in the long run, it'll save the provider, or at least the managers especially, a lot of time from having to go back and reference these individual interactions. Now, what we're able to do is that we've set up a search and reporting function. Now, if I click F2 again, oops. Now, if I click F2 again and I type in report, notice we've got custom report available for all of these service forms, from communicable diseases, healthy babies, home care, mental wellness, and nursing. So for example, if I go on my mental wellness custom report, all I need to do is simply right click the from, and this is telling the search what period am I looking for. So I'm going to say April 1st until March 31st. And now all I have to do is click run report. And what that does is it generates every single interaction that has occurred with the service form within the parameters that I've set. Now with this information, all I need to do is go to report, utilities, and save it as a tab delimited. Keep note of where that's being saved, title it whatever you want. And now when we go into Excel, we need to go to data, from text. So we're importing the data from a text file. We just select the file that we had just exported. Now we've got all of our data organized in separate columns, row by row, from every single interaction that we've recorded within this time period. Now this allows us the freedom and the ability to organize the data to tell the story that we want to be able to tell with it, and organize our CBRT reports accordingly. So here's an example of some information that I've dropped into our service form. Now we've developed some Excel templates where it's just as simple as a copy and paste to be able to organize the data accordingly, which means we've got these tabs set up, and the blank template keeps these tabs here. And all it's waiting for is for the data to be copy and pasted accordingly into the correct positions. And what the macro, or what the Excel form will do, is it will generate the data the way that we want it to spit out, instead of us having to manually manipulate the data. Now, for example, this is some test data that I've used to demonstrate the ability of these Excel macros. So we copy this information. This is straight from our text file. We would paste it right here under patient piece. And this is essentially the exact same data from right here, 4960, 4960. I've copy and pasted it into our Excel form, or our Excel template. And when I press refresh data up at the top, refresh all, what should occur is that the data in these charts will update automatically. So we have a breakdown of all of our CBRT reporting needs, from mental wellness activities. This is broken down into suicide awareness, symptoms, crisis intervention, etc. We have a suicide intervention tab that captures the sums of suicide within our community in this period. Substance abuse and addictions, how many people had come in for certain screening and assessments regarding substance abuse. We've got a count of our referrals to treatment centers. We have substance use and addictions mode. So this is the sum of presentations that have been conducted with regards to different topics such as substance in schools, substance addictions, culture, etc. The service linkages is again coming back to that mental wellness forum where we were asking what kind of external parties were involved in this interaction. And then we can see a visual of all that information here within the period. And we've gone beyond this a little bit, and this is some added homework, but we're able to view the primary issues for the service with regards to what is the most common interaction for our mental health team. And then our secondary issues as well, not only our primary. So you can see just by using one simple form, we're able to organize our data and organize such a greater picture beyond we seen patient X. And this is the this is the value of these custom forms. And this is the value of these forms. We're able to tell a greater story and add a whole lot more perspective for our community and what we're providing as healthcare providers to our patients. We're also able to use these forms mobilely using the Ocean tablet software. This allows us to use a tablet with the patient, and we can gather this information remotely or in our waiting room or service room, wherever it may be. So in order to use the Ocean tablet function, we need to first open up our patient. So we'll go to record, open up their chart, and I'll do a search for 102. That should bring up Grandpa PSS. So what we need to do now is look for the Ocean tablet patient ID number, which is going to be appearing right here where this hyphen is. Unfortunately, it's not there. So we need to click on this black dot on the Ocean toolbar. The toolbar will pop up and it should generate us a number here shortly. I'm not going to do anything. 2591. So let's remember 2591. So now on my tablet, I'm going to my Ocean tablet application where I'm going to be greeted with a pin pad. Now we're going to need to go back and find that number, which was 2591. And this is going to tell the Ocean software who the patient is that I'm delivering this form to. So I've already preloaded the tablet to always display my mental wellness service form because this tablet is specifically delegated for that service and for that process. So this is asking me, welcome to the family health team. We can customize that greeting page as well. And this is some information. If they wanted to update their demographics, they have the ability to do so here. Otherwise, they press next. Now, this is the first part of our service form. This is the main information of the service details. We're asking the location of where this took place, what type of service has been delivered, the mode, time spent, primary issues, secondary issues. And it gives us an option once we've got all this information checked out that we can go on to the next page and fill out the form based on the information that is relevant to the service. And when the form is filled out, it's going to give us a little thank you, please return the tablet. So that goes to show you the different ways in which we can capture this information so that we can have it available for our CBRT reporting at the end of the year. So I thank you for watching, and I very much encourage you to go through these GHL service forms. Again, go into your custom form library, type in GHL, and check out our service forms that are available for your department. If you have any questions, give us a call at 1-800-985-5713, and we'd be happy to help. Have a great day.